I thank the gentleman very much, Mr. Chairman, and our ranking member, thank you for holding this hearing. It's a very important issue. We need to explore the problems with this face-to-face regulation. Our nation has made a promise to seniors who rely on Medicare, and we must keep it. And one way to keep this promise is through home health services. So I'm happy to introduce Sarah Myers, who will be sharing her knowledge about what's going on out there. She's the executive director of the Oregon Association for Home Health Care. Sarah has been recognized for her outstanding contribution to the Oregon home care community and has provided the Oregon delegation with a wealth of information on the critical issues facing home health providers and the patients that they serve. In general, home health, as you know, is less expensive, more convenient, and just as effective as care in a skilled nursing facility. Receiving care at home gives seniors more control over their health care and provides a sense of comfort, familiarity, and normalcy for the patient and for their loved ones. I know this firsthand because it was the choice my parents and I made, and in Oregon, more than 20,000 Medicare beneficiaries make that same choice. However, under current documentation requirements associated with the so-called face-to-face requirement have placed significant pressures on the home health care community and the people they serve. In order for a patient to meet the eligibility criteria for home health, a physician must document that a face-to-face meeting occurred between the patient and a physician or non-patient practitioner, or non-physician practitioner. While intended to be a way to reduce waste, fraud, abuse, by ensuring the orders and certification from home health care are based on actual knowledge of the patient's condition, unclear documentation requirements from the government have led to a slew of payment denials and additional documentation requests. So we have a situation in which a complicated regulatory process simply needs to be streamlined and standardized. And that's what this legislation would do. First, it requires the Secretary to develop a single standardized form which satisfies the requirements of the home health certification. And second, the bill streamlines the process and eases the requirements if the patient's been discharged from the hospital or a skilled nursing facility. Third, anyone who uses this form must receive proper notification and education on the documentation requirements. And finally, the Secretary must implement a process to reopen and review claims which were denied solely due to the face-to-face documentation concerns and issue revised decisions if the claims were denied because of the patient narrative, a requirement that even CMS recently dropped because of the burden on providers. So, Mr. Chairman, this isn't just about a backlog of appeals and red tape. It's about improving access to and quality care of our seniors, and that's why this legislation has the support of the home health providers, including the Partnership for Quality Home Health Care, National Association for Home Care and Hospice, and the Visiting Nurses Association of America. Mr. Chairman, I ask unanimous consent to submit their statements for the record. I also would like to submit into the record 3 letters to CMS from 2011, 2013, and 2014 from the House and Senate expressing concerns with the face-to-face documentation requests.
Without objection, so ordered.
I thank the chairman, and I appreciate his indulgence and your work on this legislation. I yield back.
Chair, thanks, gentlemen. Now